Hello, my name is Jill Whitaker. I'm the director for the Student Wellness Center, and welcome to Lewis. We are so pleased to, myself and my colleague Catherine are so pleased to be speaking with you and welcoming you and your student, your loved one to Lewis University, and to talk today about the support, the services, the resources to encourage the health and the well-being of your student. Catherine?
Yes, welcome to Lewis University. My name is Catherine Mueller. I am a campus nurse practitioner and supervisor of health services.
So I am going to just start out here. It's a pleasure to be talking with you all because this is an incredible time, college and the decision to come to college for your student in terms of choices for career and development. This slide really kind of focuses on our role here in the Student Wellness Center, but also just in general, the efforts of the educators, the faculty, the staff, and our partners in student life and academic services in terms of the whole developmental process of students. There's so much that happens in these college years in social emotional development and identity and purpose and finding meaning. And all of us here at the university and our focus in the center as practitioners, counselors, and nurses, and our role in education and health promotion is really to support this whole student developmental process.
And here at the Wellness Center, wellness is what we focus on. And so when we think about wellness, oftentimes we think about physical wellness and our physical health. But on the left-hand side of the slide here, this wellness wheel is just a great reminder that there are many dimensions of wellness, not just our physical health, although that's one of them, but occupational wellness, spiritual, intellectual, social, environmental, and emotional. These are all important aspects of wellness, along with physical.
And we view you all, parents and family members, as key allies in supporting students. Here in the center, about half of the students come on their own initiation to seek health and counseling support and services. The other students, the other half, really report that they have been encouraged to come for care by their family members, by their friends, by their peers, by another helper in academic services, a tutor, a coach. So we want to tell you here in the Wellness Center, in terms of the partnership, we feel it is vital for you all to recognize your role in encouraging students to access the resources and the care here. College students right now, and for a long time, but particularly since the pandemic, we are knowing that there's just an uptick in mental health and stress and anxiety. And we here in the center are here to support, but this slide is really focused there. I know you can click on a video of the National Alliance for Mental Illness created a wonderful video about transition to college and a helpful college guide. And these are some general tips in terms of role of family members to just kind of be aware and recognizing the stressors and promoting the access to care and reducing the stigma and help seeking. Sometimes students really want to present with, that confidence, like, I've got this mom, I've got this dad, but really it's natural to be stressed and to recognize that it's okay to talk with someone to get the support. Catherine?
And part of supporting student well-being involves bridging those gaps in care. So in terms of healthcare, knowing your campus resources, and we'll talk a little bit about that today. Also establishing primary healthcare for chronic needs. So if you're coming from out of state, having a local primary care doctor that you see annually, as well as knowing all of the resources available to you at the university.
So this chart is really just to help us talk about our scope for services here in the center, and also for you as family and loved, or thinking about your loved one as they're starting college, knowing that all of us, at times need to self-care. It's natural to have anxieties and stresses. There's a spectrum in that green and that yellow of kind of normal stresses and behaviors, feeling nervous or having some challenge with sleep, if you're nervous about a presentation or you're nervous about change. But when we can navigate that in our natural support systems, and it's when things start to get a little bit more intense, our behaviors or our symptoms are affecting our lifestyle and keeping us away from our goals, and our hopes and our plans. So for example, with a college student, if they're having trouble getting up and out and engaging socially, entering into the community here, attending classes, really want you to know that the support system here in the Student Wellness Center, and really, to be fair, throughout the university, this is very much part of our mission, is to make sure that we have a community of support. So we are allies and partners with many, many departments and faculty staff. They refer to us and we to refer to them. If students are starting to get more into that orange and red zone, we really want to start linking them to professional care. And Catherine and myself are representing the Student Wellness Center as the professional support services here in the campus community. And we just want you to know that this is our scope. When we see students in the center in this orange and red zone, when they're really, not feeling well, we are going to work within our scope here also. And if there's more imminent risk for harm to self or others, or they're needing a specialist in the community, we are tuned into those presenting symptoms, and we will make sure and partner with you if appropriate, inform you if appropriate, if there's a real emergent need, and we will link students to care. Catherine, you may want to add a little to that.
Sure. Just chiming in from the health perspective too, sometimes people, whether they're students or anyone, they might seek care in the orange and red zone, but just a reminder, even in that like green into yellow, it's great to seek care. It doesn't have to be, really, really severe to seek out resources. So that's another great reminder for students. Even minor stress, it's not a bad idea to seek us out and see how we can help you. Of course, we can help when it gets more severe, but even minor, what you might consider more minor things, we're here to help with that too. And from the medical side, it kind of parallels, right? So we treat minor illness and injury. We see a lot of students for sick visits. If needed, campus nurse Marion and I know how to refer to the community if it's beyond our scope. If it needs a higher level of care, we help the student do that. So that's a little bit of the health perspective as well.
Absolutely. And we collectively in our center see upwards of 800 students. Last year we did, and as Catherine was saying, most were in the green, yellow, and orange zone, right? Real preventative and proactive, every so often more of an urgent care. And then there's links on here with some resources and reading for you, and also some more information about our assessment and care team, which is an urgent care support and a community of care here. And so this actually just is a quick picture of our services last year, and you can see that the top 5 reasons for students seeking services here in the center, and just some general feedback from students that they felt supported, that they'd be likely to seek additional counseling. We see a lot of students that have not, more than half of the students have never seen a counselor before, so they're first timers, and that's really encouraging to see that they feel like they may be willing to talk to another person in the future if needed. And again, you can see the majority of our services are between 1 and 5 visits. So we really are focused in a strengths and solution focused REEF model of care, and really trying to problem solve and support students with their presenting concerns. But we also have a flexible care model, meaning we will see students longer if it is appropriate, and we work on their goals, and particularly if there's barriers to access to care, we will serve students flexibly here in the center.
And one thing I'll highlight on this slide is that out of the students who came for a health visit, and these are students typically coming in with maybe an earache, sore throat, so true health visits, 31% of those students are indicating some kind of mental health concern in their personal medical history, which is quite significant, 31%. So just again, a reminder that it's common, it's prevalent, there's many stressors of college life, but we are an integrated center. The health services and counseling services are very integrated. And when on the health side, we discover this, it opens up that conversation with the student to make them aware of all the resources we can offer them, and offer options, and see what they desire for a next step.
Catherine, do you want to go ahead and just begin?
Yes, absolutely. So on this slide, we have an overview of our services. So we have health services and counseling services. Like I mentioned, we are integrated, housed within the same space, the Student Wellness Center. And we are here Monday through Friday, 8:30 a.m. to 5 p.m. So we take appointments, but we also take urgent care walk-ins. So appointments can kind of help them be seen right at a certain time. But we do, of course, take walk-ins as well. On the health side, as I kind of alluded to earlier, we do treat minor illness and injury. So common ones being sore throats, cough, fever, earache, some minor injuries. And we also offer urinary tract infection, UTI testing and treatment, STI testing and treatment, help with immunization compliance. So we offer vaccines here, screening for TB, which might be something that nursing and health sciences, sometimes education students have to do for their program. So we offer that here for them. And we offer general health information and resources to promote overall health and wellness. We do have medications here, prescription and over the counter. And we're excited to share also our new Verilux Light Therapy box for seasonal affective disorder. So this helps with the winter blues. And then a relaxation / massage chair available for them to use.
Yeah, that's wonderful. And we have in the center, we have 3 full-time counselors and a clinical training program, and 2 GAs that actually work both with health and counseling services. So again, I shared we do a brief model of therapy using kind of best practice treatment and support. And then I'm not sure, we're having a challenge with our slide here. So I'm going to go ahead and link to this next one. So we have a very exciting new partnership with Timely Care, which is a telehealth 24/7 support. It's a network of practitioners, both medical, mental health, health coaching, and self-care resources that is available for the community. It's really quite an incredible partnership. We're very excited about it. And onboarding this summer we have been, and we've started its services. Students are enrolling. There are on-demand resources and scheduled resources. They can prescribe medications. I'm going to have Catherine talk a little bit more about that. And they offer psychiatric services with referral from counseling.
Yes, so on the medical side for this Timely Care telehealth platform, they offer Medical Now, which is a service where they're connected with a doctor, a nurse practitioner, or a physician assistant relatively immediately. And by that, I mean within 5 minutes. So if they need medical advice right away, they can choose the Medical Now feature and be connected with a provider who can talk to them about their symptoms. Also, from the medical side, they can do a scheduled medical visit. So if they want a visit 2 days from now or tomorrow or 4 days from now, they can go ahead and schedule that visit for the date and time that works for them. And they can choose the provider. After reading their bios, they can choose the one that seems like a good fit. So there's both immediate or urgent medical care available, as well as scheduled medical visits. And they treat, I believe it's over 200 different conditions, anything from skin, dermatologic, issues, cold, flu, sore throat. They really can do quite a bit. They will prescribe medication if they deem it necessary. So antibiotics, steroids, really anything that's not a controlled substance or chronic medication. So they're available for medical needs.
Very helpful resource. Another great attribute of this partnership is that the students can access this when they are at home. If they don't live in the Chicago area or they live out of state, they can access this service and meet with licensed providers that are licensed in their state. They can also access certain aspects of Timely Care even out of the country. So we're very encouraged by this partnership.
Yes, and these are some of my tips for staying well on campus for students. So the first one being that Timely Care telehealth platform that we just talked about. So encouraging your student to download that app today. Again, this is a free service to them. So there's no copay. They don't need to use any insurance or pay anything for the visit. The medical visits are completely unlimited, and the counseling, they have up to 12 per year. So that just downloading that and having it ready would be my recommendation. And the next one would be establishing care with a local primary care doctor if they don't have one already. Sometimes students come to Lewis University from another state. And if that's the case, I recommend that they establish care with a primary care doctor in this area. And I'm happy to help them get connected with one. So they can always reach out to me and we can help with that. But it's important for those annual visits, even when they're healthy and there's no concerns, it's still good to have a primary care physician. And then along those same lines, having a plan if they're on any prescription medications, a plan to have enough on campus with them, and a plan to refill them. So some that come to mind would be like for asthma, if they have an inhaler, having that on them at all times, knowing how to refill it when needed. EpiPens, things like that, just making sure that they're prepared and they have medications. Number 3, it sounds basic, but college students are very busy, and sometimes the first thing to go are those basic needs. So just ensuring and encouraging the student to get enough sleep at night, drinking enough water, staying hydrated, getting that good nutrition in, and trying to manage their stress along the way. The fourth one being
one back.
Okay, just knowing resources, so both on and off campus, which is a big theme of today in our presentation. So again, having that primary care doctor, and also knowing that the Student Wellness Center, we're here for the student. being familiar with some local urgent cares and ERs ahead of time. And then again, that timely care telehealth, such a great resource, so great to have downloaded on your phone at the start of the year. And lastly, just ensuring that they have health insurance. It's very important that everyone be insured, again, even though they're healthy and young, an injury can happen or something can happen and you don't want to be uninsured. So we do offer at the university a student health insurance plan. It is optional, but it's there for you if interested. Many students are on their parents' plan, which is great. But if not, we do offer a student insurance plan. The deadline to enroll is September 30th. For the fall semester, and the annual cost is really quite affordable. For the entire year, it's $536. And they're covered for the entire year, August 1st through the following year, July 31st.
Just a quick highlight of, again, the dynamic benefits of accessing counseling support, really overall health and well-being, and also academic benefits, improved grades and patience and communications and relationships and confidence and so forth. And these are actual feedback points from the students from last year's survey, that they really felt like the support that they received here in the center did help them academically, educationally, to continue to move toward their career goals, their college and career goals. So encouraged by that. Catherine?
This is just an important immunization reminder, and your student has been receiving many email reminders. They go out twice a week throughout the summer, so I'm sure they're familiar with these emails that have been coming through as a reminder that our immunization submission deadline is coming up. It is September 1st. And just a reminder, this is required by Illinois law, just like for high school and really all the way, even sometimes preschool, grade school, middle school, high school. It's the same thing. It's the College Student Immunization Act. So these are required by law for attendance at any college or university. So the submission process is that they sign into MedProctor using their Lewis credentials and just upload those immunization records. Again, that deadline is September 1st. We're here to help them with the process if they run into any issues, but generally it's been going really well and it's very easy to upload them. They are verified within 1 to 3 business days, and they get an email letting them know if their records are complete or if they're missing anything. So that's coming up, and we're here to help them if they have any questions with that process.
These are some examples of partnerships for really outreach, education, health promotion. We are the Student Wellness Center staff team are thrilled to partner with the departments in trying to connect with students. And again, education is our mission here at the university. And so we know education and involvement and growth and development, right? So these are lots of examples of partnerships. And just encouraging, you see links on here, and I know other folks are talking with you all about the student life here on campus, but there are links for the activities calendar, encouraging your student. So whatever, there's something for everyone, whatever really piques your student, or if it's something that they're not interested, the part of the growth and development is to push students a little bit out of their comfort zone, because they might learn something that they didn't realize they were interested in. So we do a lot of health promotion and education. And then this Instagram here is Life at Lewis U, to really encourage if your student is utilizing social media to follow, because there are all sorts of updates and information that go out daily for the students. And then I don't know, Catherine, if you wanted to touch on the well a bit, or
Sure.
programming.
Yeah, the well is within our Lewis University website, and it's a resource page for all things wellness. So along with Life at Lewis U, this is another thing we recommend your student check out and look up on our website. They could even in the search bar type the well and it will come up for them. So different resources on all things wellness.
And then this is just a picture. So we are here in our offices in the center. Catherine, I'm not sure if you mentioned about the patient rooms, but you can see we're on the lower level where the arrows are across from the Brother James Gaffney Student Center. Our center is accessible via elevator or stairs. It is a warm and supportive environment. And did you want to mention about the patient rooms?
Sure, yeah, we have a couple of patient exam rooms here, and these are on the health services side of the Student Wellness Center. So this is where they come for, these sick visits, maybe a COVID test or whatever may be going on. And then we do have a third wellness room that we're excited about with that massage therapy, the light therapy, kind of just a relaxation, time to recharge and relax.
So information about finding us online and our hours and so forth, links here. And we just thank you for this time and thank you for watching. And please do not hesitate to reach out to Catherine, myself, or anyone on our team. We are here to support your students' well-being and just so encouraged that they chose Lewis and are a part of our Lewis family here. So
Yes,
all the best.
welcome to Lewis University. Wishing you the best.